Hello there, and welcome to today's episode of the Only Endometriosis podcast you need. Today I'm going to be talking about whether you should be thinking about natural remedies, alternative medicine, call it what you will, if you have yet to receive your endometriosis diagnosis. And this is a really, really common issue, problem, question, because it takes so long for us to get a diagnosis. So many women I talk to are in that limbo of struggling with symptoms, but also in the midst of a diagnosis journey. So there's a lot of angst, a lot of confusion, a lot of general uncomfortableness about looking at a different path when you feel as if you haven't completed the first path. And I completely get that, hence this podcast. So my answer, if you are currently stuck in that kind of limbo position, is probably not overly helpful in some respects, but it is to really go with your gut instinct. So there is no right or wrong answer, really. And one of the issues with the endometriosis diagnosis pathway is that, unlike other illnesses, other conditions, the virtues of things like Reiki, reflexology, aromatherapy, even acupuncture, the virtues of things like that aren't actually given to us. They're not promoted, they're not mentioned. In fact, they're actively dissuaded by most. In fact, if you follow the NICE guidelines, they're actively dissuaded, and most GPs, most specialists do tend to follow the NICE guidelines. You may occasionally find people who do recommend bits of alternative medicine or complementary therapies, whatever name you want to give what I do. But generally speaking, they are kind of frowned upon, which I don't get because, like I say, for other conditions, they are actively encouraged. So a lot of the time, women come at it from the perspective of we've been told that they're no good, that potentially even they're damaging, although where that comes from, I have no idea. I have yet to find a single study that shows that natural ways of managing endometriosis do harm. So the conversations that I have kind of come from a standpoint of, look, I really need something to help with this pain, the fatigue, the bloating, the bleeding, the fainting, whatever else it is that you've got going on. But I'm not quite at my diagnosis stage yet. So I don't know if I've got endometriosis. It's a possibility. I've been told that chances are I have, but I don't know if I have. And B, I'm not currently finished with the pathway that I'm on, but quite often that pathway can take years. It still takes about 7-8 years for a diagnosis for endo. So if you're down that stage where you're already being put in touch with a clinic, where you're already going to see a gynecologist, then you can feel almost like beholden to that choice, to that pathway. So if you are looking to alleviate your symptoms, you're kind of just left with the only options that currently exist in the NICE, in the UK's clinical pathway, which is essentially painkillers, hormonal treatment, or surgery. You're not really given any other options. So it's all well and good me kind of sitting here saying there are other options open to you, but if you are following your clinician's guidelines, and that's a perfectly acceptable and understandable thing to do, then there aren't any other options open for you. It's literally painkillers, surgery, or hormonal treatments. But many women find that either they don't work or they don't want to try them. And again, whatever your reasoning, if you are starting to look at more natural methods of controlling pain or bringing your symptoms down, then that's perfectly valid. So one of the things that we don't do in the alternative medicine world is to look massively at labels. So it doesn't matter if you have a diagnosis of endometriosis when you come to see me. I know I badge myself as an endometriosis expert, and I am, but it doesn't matter if you don't have endometriosis because we look primarily at the symptoms. Excuse me. You may notice I've got a hell of a cold at the moment, but I'll plough on. We look at symptoms. We look at symptoms of part of a jigsaw, and we look at the whole picture of what you've got going on. We look at stresses, we look at environmental factors, we look at symptoms, we look at triggers, we look at the whole picture. So your label doesn't matter. So that's one thing that you don't need to worry about. Just because you don't have that label of endometriosis doesn't stop you from accessing somebody like me, because there's no criteria. If you're struggling with your periods, even if your periods are fine, but you're struggling with anxiety or bloating or IBS type symptoms, all of that stuff we can look at with or without a diagnosis. So hopefully that's one barrier removed. Now, another thing that has been said to me in the past is that, will this actually reduce my symptoms? Will it reduce my endometriosis? So there's no guarantees, of course, but yes, symptoms will reduce. No guarantees, brackets. Excuse me. And endometriosis could reduce as well. Now, that is a concern for some women, and I completely get that, because you've waited so long for validation. You've waited so long for somebody to say, yes, you do have endometriosis, that what you don't want to do is start down an alternative path, reduce the endometriosis, and then by the time you get to the laparoscopy, there's minimal endometriosis, no endometriosis there. Now, that is actually possible regardless of whether you have whether you use natural remedies or not. I know at least one woman who has had 2 laparoscopies. Her first one diagnosed endometriosis. I can't remember what grade. I'm thinking grade 2, but that might be wrong. And then she had another laparoscopy a few years later, and it had gone. And she hadn't really used any natural methods at all. Endometriosis can go in cycles. It can affect different women differently. So it is highly plausible that you could have a lap 1 year and then 10 years down the line, your endometriosis has cleared completely. This is a lot to do with your symptoms and your causes, and I shall come to that in a couple of episodes' time. But so there is a possibility that if you start going down the natural route, you could see a reduction in your endometriosis before the time you get to a laparoscopy. I would say if your symptoms are so severe that you are desperate to find a resolution before your diagnosis journey is up, then chances are you won't see a significant decrease in your endo by the time you get to laparoscopy, especially if you're just looking at symptom management. So the way that I work, you can either look at managing your symptoms or reducing your symptoms. So by reducing your symptoms, I mean kind of avoiding them. And I don't mean avoiding them by pretending they're not there. I mean avoiding them by stopping it get to the point. So you identify your triggers, you identify what's making your endo worse, and then if you stop doing those, you don't get the flare-ups in the first place, or you reduce it because you're not doing the things that make it worse. That by itself is not going to get rid of your endometriosis. So by the time you get to your laparoscopy, your symptoms might well have reduced, but the amount and the grade of the endometriosis, chances are that won't have changed. Excuse me. I would never recommend anybody to go all in. If you want to continue down the Western medicine path, then I would never recommend anybody goes all in terms of completely doing the symptoms causes thing and trying to reduce their endometriosis. I would always wait. I did an episode on this a couple of episodes ago. I would always wait until you've seen one path to fruition before you choose another path. That's not to say that what I do can't help reduce symptoms in the interim. So we do pain management. So if you wanted to look at ways of managing the pain, that's not to say, so remember, pain is a message. That's not to say that what's causing the pain disappears. It's just how your brain reacts to and processes that message that changes. Exactly the same as a broken ankle, exactly the same as childbirth. If you're still experiencing those issues and you're using natural pain relief, it's not that, or even non-natural pain relief, I guess, but it's not that the thing has changed. So your ankle suddenly isn't non-broken. It's just that the pain receptors are working in a different way. And we can do exactly the same. We can work on pain management techniques. That doesn't change your endometriosis. So if you are concerned, about whether using natural methodologies will impact on your traditional, so your Western NHS route, then my advice to you would be to simply look at, rather than, so whenever I start working with anybody, I always ask what the goals are. So do you want to manage your symptoms? Do you want to get rid of your symptoms? Do you just want to be able to manage them when they flare up? So I would say if you're committed on one path and you just want to look at ways of, for example, alleviating pain or stopping fainting, whatever it is that you want to do, just identify that as a single goal and only work on that goal. Then once you get your diagnosis, you can start to then look at the whole picture, because you've then got the final piece of the jigsaw in your world. That's your endometriosis label is that final piece of the jigsaw for that part of your journey. You can then reevaluate after that. So my advice would be, I don't see any reason why you can't look at managing symptoms naturally. We're not given enough options. You're not given enough painkillers. So many women say to me, and we should have a T-shirt made. Ibuprofen just doesn't cut it. So many women, painkillers just don't manage your pain. But there are things we can do to naturally, almost recondition the brain in terms of how it deals with the pain, and that doesn't detract from what's actually going on. So I hope that helps. If you are concerned, if you are thinking about natural ways of managing endo, then please do book a consultation with me. Feel free to, these podcasts are now on Substack, and for a small monthly fee you can join the community, and my paid subscribers are able to ask questions on the podcasts and the posts, so you can always leave a comment there as well if you so choose. Wherever you are on your endometriosis journey, I wish you all the luck in the world. Have a fabulous this will be going out on a Sunday, I think, so have a fabulous week ahead. Hopefully my cold will have cleared by the time I record the next podcast, although there's no way of knowing because it's gone and come back about 3 times now. But I wish you all a happy, healthy and prosperous week ahead. Take care.